Hello, it's Tammy. I thought I'd take a little bit more time today to talk about addiction as we know it when it comes to smoking, caffeine, substance use, alcohol. There's a whole list of addiction that I believe is time that we talk about it and actually take it to a different level. Um, we all have a different relationship to what we think addiction is, to how it needs to be dealt with, if it should be dealt with, what those people are, what we think of these. I mean, it's endless, the amount of stigma that's built around addiction. I mean, I've heard people say once an addict, always an addict. These are harmful, incredibly harmful, and actually calling somebody an addict is just plain harmful simply because it's considered a label. And as you know, I'm not a big fan of boxing people in. Just because someone gets involved with substance use or other addiction doesn't make them a bad person, doesn't make them weak, doesn't make them have, no willpower. I've heard people talk about, I don't have willpower, not me, but they don't have willpower with sugar and carbohydrates. And that's not true. There's a lot of factors that are involved. And when we get into the more hardcore addictions, it is actually related more so. Yes, there are psychological, behavioral, so they like to claim socioeconomic issues, but I don't believe in the socioeconomic. I have witnessed plenty of addictions by people who have decided that recovery was the direction they wanted to go. Yay for them. But these folks were coming from, what we would consider people that shouldn't be addicted, right? If we talk about socioeconomic, we think of the poor, the destitute, those living in the streets. Our financial status drives us to use. I just disagree. I think no matter where you are, no matter what you do for a living, no matter what your living circumstances are, you are you can, pardon me, I stumbled over myself. You are not any better, no matter what you do. You're not worse than somebody else. You're not better than somebody else, because really what's setting us all up for addiction has more to do with what our body chemistry is producing. There you have the biological genetic components. Now, they say that about 50 to 60% of the people born to alcoholics become alcoholics. Well, I don't know that that's always the case, but I do know that and you don't even have to. With the other studies that they've done, is these people don't even have to live in the same home. They can be adopted out by other families and still develop alcoholism. So it's a very complex, that's the way I want to describe it. Addiction is complex. And from my perspective, it's very biological. Whether we talk about which came first, the behavior, the exposure, I personally believe that it starts within. And because I also know that people will use certain drugs and get involved with certain things and don't ever become addicted to it. They can take it or leave it, So I want to really go out here and say that addiction is not a problem of weakness. It's not a problem of mental instability. It is, the way we like to frame it, it is more about how our genetics are functioning, how our genes are working, and how the chemistry, as I said, and what it's producing. So that said, there's a lot of drugs that affect they affect the different receptors, the neurotransmitter receptors. I'll give you an example. Alcohol works on the GABA receptors. Okay, GABA is known as an inhibitory neurotransmitter that helps to self-soothe. If you activate those receptors, which alcohol does, you can begin to produce too much GABA, which will then create anxiety. Hence the reason why, along with a combination of other things, you can't sleep for very long once you've been drinking. You will wake up because the blood sugar has now been affected. You have a lot of, and that's the reason why you need more alcohol, because you actually need to be able to soothe. So you need to stimulate the production of GABA. Now, I am oversimplifying everything, but what I'm wanting to do really is to kind of presence everybody to really what's going on chemically within the body, because my desire is to eliminate the stigma and help these folks find the help they want and the help they deserve. Now, not everybody wants to overcome their addiction, and that's okay. This isn't me trying to force people to do something they don't want to do. This is me asking the world to let's think about what we're really doing here and how we're actually causing more harm than good when we start talking about addiction and not paying attention to really what's happening to other people and helping them rather than shunning them. So alcohol does the GABA receptors. Cocaine works off of the dopamine receptors. So it's actually a dopamine reuptake inhibitor, which is very similar to what Wellbutrin is and a couple of other antidepressants. So cocaine actually has an antidepressant effect, and it stimulates those dopamine receptors. Now, a lot of us know that the dopamine also works in the reward system in the body. So there's a number of substances that we can take in, and even though they have effects on the body, they eventually work on the dopamine, that whole reward pleasure experience. So, but cocaine itself actually does affect the dopamine receptors, and all of these things ultimately impact the immune system. Now, I'm going to briefly touch on that and explain why. So, histamine is a neurotransmitter. Okay, so if you haven't watched any other videos, but you're watching this one, I will tell you that when one thing goes out of balance, when one chemical goes out of balance, or one system, the body works to create a balance. It works to restore that balance. So if you have a neurotransmitter imbalance to begin with, that is seeking balance, we end up finding ourselves involved with these activities and these substances because we're trying to actually normalize. We are truly self-medicating, but not from the perspective of poor me, woe is me, I can't deal with it. You're actually intuitively rebuilding your own chemistry. Now, is it effective? Temporarily. It's not long term. So that's the reason why we end up developing repetitive use, which then evolves into abuse. Then that evolves into addictive behavior because we need more. Because the more we need, the more we use, the more we need. Because the body begins to stop producing at the level it needs to the correct chemicals, the natural chemicals that the body naturally produces. So histamine is a neurotransmitter as well. So if you've got dopamine imbalances, you have serotonin imbalances. If you have a GABA imbalance, no matter what, the rest of the system starts to fall out. Okay, so histamine would be one of them. The histamine actually also works with the major histocompatibility complex, which is our immune system, basically. And that's the reason why when you have a histamine reaction, you get a runny nose, you get watery eyes, you get, there's itchiness, there's congestion, depending on what you've got going on. And histamine issues are related to depression. They're also related to stomach problems, irritability, insomnia. So these things all are can directly be related to histamine. However, it's difficult to tell, and that's the reason why I am a big believer in establishing a balance within the brain and these glands that are producing these chemical messengers, such as the hypothalamus, the pituitary, the adrenals. That's a particular axis. And if we can restore balance to the endocrine system, the neuroendocrine system, you don't have to try to juggle these different neurotransmitters, because you'll actually be bringing balance into the whole body. Now, is it necessary to help, restore balance to an immediate neurotransmitter? Well, it does benefit, but not long term. What you want to do is you want to source the body to be able to restore these chemicals on their own. So what do I recommend in that case? I would recommend getting your digestive system back into balance, because the digestive system is where the neurotransmitters and hormones, the stimulation for the production begins in the digestive system. We can read this all over the place, but the bottom line to that one is because you have to digest your food, which, duh, no brainer, right? And then you have to assimilate your food. And if you're not assimilating the carbohydrates, which are needed, we can't be skipping carbs. I realize there's a lot of thought processes out there that try to eliminate carbs, like with autism. And again, these could be temporary fixes, but the way the body wants to function is to break down carbohydrates, and there are carbohydrates in more things than just grain. So the assimilation of carbohydrates, the assimilation of proteins and amino acids, and the assimilation of fat. So I'm kind of getting off a little topic here. I'm trying to get back into addiction, but again, the restoration of neurotransmitters and hormones begins in the digestive system. You would also want to affect your vitamin D levels, because again, the appropriation of cholesterol for hormones is absolutely necessary. Just wanted to bring myself back and go on with regards to addiction and the other receptors. So, there's the big talk right now of heroin use and opiates use, painkillers, which have a tendency to be more opiate, although they do affect, there are some pain meds that do work on the GABA receptors. There are some pain medications that, they give you antidepressants, that they call tricyclic. They're not the normal, but what they try to do is regulate those neurotransmitters to help reduce the pain. And again, so if if you're taking an antidepressant for pain, that is working on your neurotransmitters. However, the ones that we're majorly concerned about are the muscle relaxers, are the things that are based off of heroin, morphine, the opium, which is where they that actually all derived from the opium flower and the opium plant. I'll put it that way. So we actually have something that they've named opiate receptors. Now, why is that one called opiate receptor as opposed to some big, scientific name that doesn't make any sense? Well, because science has recognized the fact that opiates actually activate these receptors. Endorphins are an opiate. They actually work with those opiate receptors. But there's a number of different chemicals that actually activate these, and we know what opiate receptors do. They help relieve pain, they help relax us, and this is incredibly beneficial for the immune system. And believe it or not, endorphins are produced in the immune cells. So the healthier, so now we're getting back into the chemistry of neurotransmitter imbalances affecting the immune system. And by the way, according to German studies, the major histocompatibility complex is the most adapted complex on the planet. Out of everything that humans have going on, that's the one that they're seeing the biggest variations in. And that would go to explain why so many people have so many adverse reactions to the environment, the technology, which includes vaccines. No, this isn't a bash on vaccines. I'm not even going to go there. To me, that's a political issue, very much so. However, it is important to remember that the major histocompatibility complex, our immune system, is probably the most altered genetic complex. And so therefore your your entire neuroendocrine system is going to be out of balance. You're not going to be producing the endorphins. That's the reason why exercise is so important. It's also explains why exercise becomes an addiction. We think it's healthy, but or sex for that matter. Yes, sex is, for those of you who aren't familiar, sex, love, and relationship actually is considered an addiction. I've worked with folks that have sought treatment for that particular issue. And as we know, exercise, sex, these things produce endorphins that are now picked up by the opiate receptors, and they bring this sense of peace, this calming, soothing, and it can be addictive because what happens? The opiate receptors are also in the same area of the brain where the reward pleasure area for dopamine is. So these all factor in, and the reason why so many drugs actually play into the pleasure reward, even carbohydrates. Is it possible to break these addictions and restore balance to the body? Definitely. Before I go there, though, I do want to mention we also have something known as the endocannabinoid system. This is the reason why we have so many people pressing for the legalization of marijuana or cannabis. Again, it's called endocannabinoid system because scientists have recognized the fact that we have this network of receptors that are working directly with pain relief, inflammation, as well as the immune system. It operates directly off the hypothalamus pituitary adrenal axis, and it does work with the cannabinoids found in marijuana. Now, the two particular cannabinoids are CBD and THC. Now, I want to say a little bit about that. These are considered fatty acids within the plant that once heated is now converted to the CBD and the THC. Prior to that, it's a CBDA and a THCA, and these fatty acids, like I said, have to be heated in order to be converted to the form that are being purchased or you take in. When I say purchase, there's a lot of people selling CBD. There are certain areas in the country where we have legal dispensaries to sell cannabis, and so you can buy edibles, and you can also buy the weed itself, which then gets smoked. Then you've got it heated. I'd be happy to do an entire talk on that particular plant because if I think it's the be-all, end-all for healing, the answer is no. I'm just going to say that. Do I think it's beneficial for people? Yeah, I do. But I also want to go out and tell you that cannabinoids are found in other plants. Not an extraordinary amount of plants, but they are found in other plants. And one of the things that we also know is that THC and CBD actually affect different receptors. All right, now here we go with this. THC works off of two receptors, and it has a psychoactive effect when it's been heated. It does help relieve pain. It does help relieve nausea. It is not a recommended constituent if you are dealing with obesity or if you have any other endocrine issues. Now, again, we're not really talking about addiction right now, but although there are some schools of thought that say that you can be addicted to it, I don't know that that's the case. But I just want to say that it's not advisable for people who are dealing with weight issues, not just because you get the munchies, because it's actually working against the endocrine system with regards to obesity. Now, because of the fat tissue is actually considered is actually considered part of the endocrine system. CBD, on the other hand, works with the other receptors that deal more with inflammation. It works up against the capsaicin receptor, and it doesn't do the same thing for the body that THC does. It's not as powerful as the THC, and there are ways to affect the capsaicin receptor with something other than CBD, such as red chili. Cayenne, capsaicin that's why they named it that, because that's why they named it that receptor, because they recognized that constituent in red chili powders does work on that particular receptor or set of receptors. So I guess I kind of stepped away from addiction, but I just wanted to say that there is something called the endocannabinoid system, kind of give you some idea of what it's actually doing for the body, and also let people know that there are other ways of affecting that particular system when it comes to other plants. The reason I bring it up with regards to addiction is because there is in New Mexico, there is the legalization of medical marijuana. And so when we have people who are detoxing and cleaning up from addiction, oftentimes due to the other issues, there's co-disorders. So I want to say something about addiction. There are co-disorders. And this is what actually brings up the biggest stigma for people. Because, the thing is it's not just, it's and this also factors into the genetics. And it goes back into stress. And it goes into trauma. So many people that are dealing with addiction or have faced addiction also had other issues in their life. Now, which is making addiction not so much as inheritable as it is relatable to experience. And we can say, well, somebody experienced trauma and it triggered their addiction, could be pain, right? Well, I'm going to tell you that the stress of whatever people go through, depending on their genetic makeup, affects the way our body produces chemistry. It causes these adaptations. Again, if you haven't watched the video on stress, it's very important to understand that stress has its benefits, and the benefit is that it actually creates adaptations within the body for the preservation of the species. However, chronic, prolonged stress without the need to, even though trauma is significant, that goes on long after the trauma is over, because other things can trigger it. People can trigger it. Situations can trigger it. This is why it becomes, also psychological. And so learning how to rethink, which is cognitive, and react or respond differently, which is behavioral, as well as cognitive. Just really bringing mindfulness into this is so important. So this stress over time creates these chemical imbalances within the body. The sad part about it is the body doesn't know how to undo what it's done. That's the crux of PTSD. So anybody who's living with an addiction is actually also managing on some level a history, a story of something that happened. And it's also called co-disorders. So that could be, anxiety, depression, bipolar, PTSD. These are all the labels that we give these conditions. But the bottom line, back of the mind, is what we're doing is we're actually overriding that stress and overriding the chemical imbalances. So being able to not just address the addiction itself, but understanding what, why they're self-soothing. So like I said, we have some facilities here in New Mexico, that due to the legalization of medical marijuana, people are actually being administered prescribed marijuana for the reclamation of their life, so to speak, where they're, relieving the depression, relieving the anxiety. It's another way of treating people as opposed to putting them on a pharmaceutical. That's the reason why I bring up the endocannabinoid system, and that's also the reason why I suggest to people that if you don't want to do medical marijuana and you're not, if it's just something you don't want to do, there are other plants that do contain these cannabinoids that have the same effect on these receptors that I've mentioned thus far, and I've seen remarkable results with folks who are overcoming either addiction, overcoming the co-disorders, dealing with something entirely different, another mental, emotional, or I should say just chemical imbalances such as in autism and schizophrenia. That said, though, essential oils are not the same as anti-drug vaccines. All right, so there are some people that are really facing some significant substance use that they're trying to break, and so there are anti-drug vaccines that are being administered. Again, as I've mentioned in other prior videos, it is possible to work alongside these pharmaceuticals with the use of oils in order to help overcome the need for these vaccines and nourish the body on a cellular level. Essential oils provide the instructions to the DNA that actually help with the uptake of nutrients. All right, so that's what oils do. They do not contain the nutrients. They provide the instructions to the DNA, much like they do in their own bodies. And in which case, at that point, they modify genetic expression, and the use of nutrients is better facilitated, and in turn generates a healing process that the body is capable of managing, and therefore lessening any depletions that may occur from taking these other medications, as well as the depletions that occurred due to nutritional issues while using. So in the face of someone needing an anti-drug vaccine, essential oils work. In the face of someone managing abstinence or weaning themselves down, the use of essential oils helps to regulate the neurochemistry, again, providing the nutrient uptake that helps to help bring the neurotransmitters and hormones back into balance, restoring sleep, the sleep cycles, restoring balance to the entire neuroendocrine system, ultimately restoring wellness to the body as the body can begin to take on healing. I really want to reiterate that nothing heals the body but the body itself. And it doesn't work with just one thing. It takes a collection of things, a collaboration, if you will, of people with the knowledge of how to care for these people and support these people, as well as plants and really intentional nutrition. So as I said, and also there are ways to affect the opiate receptors without the use of medication if it's not, where they're needing the anti-drug vaccine. It is very, very possible to activate the opiate receptors. It is also very possible to help modulate the immune system and help restore balance to that major histocompatibility complex that I talked about. I'm trying to recall anything else. And a couple of other addictions that don't necessarily always involve substances, however, they are related, number one, to the genome, imbalances within the genome. They also do continue to cause stress, emotional stress, that's not being discussed, that's not being managed properly, which is also going to further cause adaptations to occur, and then depleting the body even more so. And those would be things like I mentioned earlier, sex, love, and relationships is generally under one category. There's gambling. There's spending. There is also a really significant one called self-harm. I've seen it in minor situations where people pick at themselves incessantly to the point where people will bang their head on the wall, requiring a helmet. This you often see in autism. It doesn't mean that the child living with autism is addicted to the self-harm. It is more about the behavior that's causing this underlying stress and being able to modulate that. Nonetheless, other forms of self-harm include, that we all have heard of more than likely, is cutting. And that is pretty significant. And I've seen some really, really extreme cases. Food is another one. There's no reason for anyone to be harming themselves at this level, because the stress that these things are causing is extraordinary, and it's only upsetting the health of that individual even further. Yesterday I was speaking with someone about, how to break the cycle of addiction. And does anybody really need to have the experience of an addiction to be able to support people overcoming an addiction? And the answer is no. However, we do need to be skilled at change. We need to be open and expansive about change and stepping outside of that box and being a powerful stand for people to get their life back. And, a couple of things that you can do to help people is help them find their compelling why. You may know people who are addicted, who are dealing with an addiction, and they have no reason why, because the idea of being on the substance is far more safer to them than creating entirely new change. So helping them find their yay, helping them find their compelling motivational reason for waking up in the morning. That's our job. And you can absolutely do this with with essential oils, helping to regulate neurotransmitters and hormones and restoring balance one drop at a time.